last item of the day. Madam Clerk, would you please read that into the record?
Chair Hartman and members of the board, departmental item number 5 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Dr.
Good afternoon,
Delrenoso?
Chair.
Good afternoon. Good to see you.
And good afternoon, Chair Hartman and members of the board. Dr. Ansarg and I will be presenting the COVID-19 updates today. Next. I'd like to start with our summary, and this can be found on our community dashboard. We are seeing a decrease in new cases, active cases, and hospitalization. With regards to new cases, we are reporting 143, which is a 53% decrease from 2 weeks ago. The number of active cases is at 1,186, and this is a 49% decrease from 2 weeks ago as well. Total cases for our county stand at 83,017. Our case rate per 100,000 has dropped as well, and it is now 42.35 per 100,000. Unfortunately, we are, as anticipated, seeing an increase in deaths. We have 5 new deaths to report, and all individuals were 70 plus years of age. 4 had underlying health conditions, and 1 was associated with a congregate care site. We are reporting 77 hospitalized with 13 in the ICU. And again, this is a decrease of 22% from 2 weeks average. Total deaths in our county stand at 636, and testing positivity stand at 13.4. Next. Our case rate, this is a snapshot of our case rate throughout the pandemic. And as you can see, the red text describes the Omicron surge, which peaked at 257.6 cases per 100,000 earlier in January, and it has steadily, drastically decreased to current of 42.4. So this is a roughly a 72% decrease from the last 2 weeks. Next. This is a graph that describes our case rate by vaccination status. We are seeing a decrease of case rate among unvaccinated in the last 2 weeks of about 31%. Among the vaccinated is more dramatic at 60%. The risk for infection and severe illness and death remains high among those that are unvaccinated in our community. As you can see, data as of January 30th, persons who are unvaccinated are 5.7 times more likely to contract COVID-19. When we look at data from May 2021 to current January 2022, unvaccinated individuals are 2.3 times more likely to be hospitalized for severe illness. And then lastly, data from January 1st, 2021 to 2/14/22 indicate that unvaccinated individuals are 6.8 times more likely to die than persons who are vaccinated. Next. Our hospital capacity is improving. Currently, we have 35% hospital beds available, and about 26% staffed ICU beds are available. Next. We are seeing, following the case trend of decreasing, we're also seeing, as I mentioned earlier, hospitalization rates decreasing. In the past 2 weeks, we are seeing a decrease of 29%, and our ICU numbers an increase of 8%. Next. Our vaccination rates. We are currently we have 71.4% of eligible Santa Barbara County as fully vaccinated, and only 67.1% of Santa Barbara County as fully vaccinated. And when we dive deeper, we're seeing a really a slowdown of the number of people getting their first shot. And we are seeing mostly people getting their booster shot. And the details of our vaccination rates by dates, by geography, can be found on our website. Next. I'd like to share this new data with your board. Pediatric vaccination coverage is low, especially for California most vulnerable children. So when we look at statewide, we're seeing that 65% of children ages 5 to 11 have yet to receive their first dose of the COVID-19 vaccine. When we look at Santa Barbara County, that number is dramatically higher at 79%. So 79% of kids ages 5 to 11 in Santa Barbara County are not vaccinated. So to address the low vaccination rate among 5 to 11-year-olds, public health continues to press on, working with schools, community groups, and providers so that accurate information is available. And we are also working to remove barriers to accessing the vaccine through our mobile vaccine clinics, through our partnerships with schools. Our mobile vaccine clinic locations and dates are posted on our website at publichealthsbc.org. In addition to this, our immunization team continues to recruit private physician offices registered in the Vaccines for Children, or VFC, program. There's a statewide effort to ensure that our providers will be ready for younger children when they become eligible for the vaccine. There will be a strong reliance on medical homes to provide vaccinations, as this younger age group are in need of regular medical assessments for early diagnosis and treatment of childhood issues, as well as their need for other vaccinations. We are in partnership with, at the national level, the American Academy of Pediatrics has issued a statement to all California pediatric providers, encouraging them to provide vaccination at their sites. And in addition to this, CDPH is working on a new grant called Kids Vax Grant to support local providers not currently enrolled in the COVID vaccine program. Next. As you may have heard, today is the last day of the state mask mandate. Effective tomorrow, indoor mask mandate will be lifted for vaccinated individuals. Everyone will still need to be masked in the following settings: in healthcare, in schools, and in childcare, long-term care facilities, as well as in jails and prison. Santa Barbara County joins the region to align with the current state mask mandate. Next. This is a slide that Dr. Ghali, Secretary of Health and Human Services, shared about the decision process yesterday at his press conference. Essentially, the move from requiring to strong recommendation of public indoor masking is based on cases decreasing by 75% since mid-January and COVID-19 hospitalizations steadily decreasing while hospital staff is improving. And the level of uncertainty is lower than before because we know more about Omicron and its impact on the community. Next. This slides describe our local thinking process. Seeing the same data trends locally, our public health team made the decision again to align with the state as well as with our colleagues in the Central Coast region. As you recall, we issued our first local health officer order for universal indoors masking on August 6, 2021, because we saw that the cases were climbing fast due to the Delta surge. And that we had reached the high transmission category per CDC indicators, and hospitalization were increasing. And there was a very high level of uncertainty due to the severity of the Delta variant and a lot of unknowns about therapeutics. On February 1st, 2022, we extended the local universal masking in public indoor setting. We saw that cases were declining rapidly from the Omicron January peak. But even though the cases were declining, they were still relatively high at 103.4 cases per 100,000. We were encouraged that hospitalizations were declining, but still really not knowing a lot about Omicron, we knew that it was high transmissibility, and we are finding that it is lower in severity. So on February 14th, we have rescinded the local universal masking in public indoor setting so that we can align with the state order on masking for unvaccinated individuals and for everyone in certain settings. We are seeing cases, as I shared earlier, coming down. Case rate continues to decline to 42.4 per 100,000. Hospitalization continues to decline as capacity of the hospitals continue to improve. The uncertainty about Omicron is a lot lower. We now know more than we did even at the beginning of the month. We know that the effectiveness of the vaccines is good, and we also have increased availability of therapeutics. And with that, I'd like to transition to Dr. Ansord for the next few slides.
Thank you, Dr. Rovinoso. Madam Chair and members of the board, while rescinding the masking mandate for vaccinated people, we do want to emphasize that this should not be misunderstood as us saying masks are no longer relevant or necessary. In fact, that would be ill-advised, given there are still a lot of people getting sick at this point. At this time, CDPH, as well as us, the Public Health Department locally, are strongly recommending to continue to wear a self-protective, high-quality mask in all public indoor settings. You may wonder, why then lifting the masking mandate? The reasons behind this decision are multifaceted, some of which Dr. Rovinoso just explained. I want to go over some that are really relevant to me as well. First, Omicron behaves very differently from previous versions of the coronavirus. Compared to the Delta variant, for instance, a much smaller portion of infected individuals progresses to severe illness and need for hospitalization. Subsequently, our healthcare system is no longer at risk of collapse. Given that we are seeing a rather rapid decline in new infections, the impact on our hospitals is expected to improve even more over the next 2 to 3 weeks. Secondly, more and more individuals have at least partial immunity, either by vaccination or from previous infection, which makes everything safer. Thirdly, We cannot stay in an emergency mode for indefinitely. We now can safely start a transition to a more sustainable way of dealing with COVID. Therefore, it seems prudent at this point in the pandemic that public health goes back to educating and recommending rather than mandating measures to help reduce the impact of COVID on our citizens. We will, of course, continue to give updates and recommendations for necessary public health measures as the current surge continues to wind down. I will be available for questions later on. May I please see the next slide? This is just that we do no longer require for unvaccinated people, but we still recommend very strongly to wear masks in public indoor settings at this point. Next slide, please. A recent study published by CDC, actually as recently as last week, showed that it demonstrated that to wear high quality mask consistently in public indoor settings reduces the risk for catching COVID significantly. A very well-designed study was able to give us these data. It shows that the best protection for the wearer is obviously a respirator, N95 or K95. It reduces the odds for turning positive by 83%. The next level down would be a surgical mask that can be adjusted to the cheekbones, and that reduces the odds of catching COVID by 66% if worn consistently in public indoor settings. A well-fitted cloth mask has still significant impact, however, not as strong as the respirator or the surgical mask. With this, I will transition to Dr. Do Reynoso for the final slides. Thank you.
Great. Thank you, Dr. Ansor. May I have the next slide, please? What to anticipate from CDPH, and it is around schools. We are getting a few questions about, can the Santa Barbara County Public Health Department issue guidance to lift the school masking? And unfortunately, as your board is aware, CDPH is the responsible party for issuing guidance for masking in schools. And Dr. Ghali announced yesterday that on February 28th, state officials will reassess and decide to move from requiring masks to strongly recommending them in schools. The state will be looking at cases, hospitalization, vaccination rates, as well as national and global trends. The additional time, as noticed to us, will allow our communities to discuss the possible changes and to help us use that time to prepare with additional protections if needed. Next. As we move from mandates to strong recommendations, a layered approach is more critical than ever. Although masking requirements for indoor public settings are being rescinded for vaccinated individuals, community members are highly encouraged to consider their personal risk in the months ahead as the virus continue to circulate. And this is even at lower levels. A layered approach is protecting yourself and others. If community transmission is high, avoid gatherings, large gatherings. If you are indoors, ensure that there's good ventilation. Washing your hands continue to be solid strategy. Masking properly will protect you in crowded areas, and especially where vaccination status of others is unknown. We continue to see higher odds of infection, as I shared earlier, and severe illness and death among unvaccinated individuals. So getting vaccinated and boosted is the most important and protective action to keep yourself and others safe. From my personal experience, don't wait because it could be too late. Lastly, get tested if you have COVID-19 symptoms. If you are sick, stay home for the duration of your illness. And this concludes our updates. Dr. Ansorg and I are available for questions.
Thank you so much. Board members, any questions? Supervisor Hart?
I just want to thank Dr. Reynoso and Dr. Ansorg for this information. These updates are really valuable. I know the public really looks forward to hearing this information directly from our public health officials, and I find it really useful too. One of the things that caught my eye is the chart that shows the precipitous drop in cases. That would be slide number 3. And, just with my layman's eyes, it looks like we're on track, before the end of the month to get down to the level that we were at in December. And then I guess it just, I'd like to know Dr. Reynoso and Dr. Ansorg's professional opinion about whether we're going to likely to go below that. I noticed the peak, or the trough actually, between the Alpha and Delta was very, very low, but that we never got back to that level between Delta and Omicron. So what is their best judgment about where we're going to go in the future? Maybe that's not a fair question.
Yeah, I could start, and then Dr. Ansorg can finish. I think that we've been thrown a lot of curveballs, especially with variants showing up. I think we won't really know until we see subvariant to the Omicron and its impact. We know that it's everywhere, but we are uncertain about its impact to our community. With that, I think that we still need to focus on getting our vaccination rates up. We still need to focus on getting the numbers of individuals that are boosted up. And I think that because with that rates up, we will have the tools, in addition to masking whenever needed, we will have the tools to handle whatever comes our way.
Well, thank you for that. That was probably an unfair question, but I appreciate you answering it.
Supervisor, there is some public comment. Supervisor Lavanino, anything?
I'm just curious about, so I don't see anything anymore about social distancing. So I kind of want to know what's the guidance there? And how does that work if you're around vaccinated people? I'm kind of looking at ourselves here. I felt for a while that I know my board members are vaccinated. We have masks on and we're still sitting 6 feet apart. And I'm just kind of curious what's the new guidance, or how's this going to work in the future?
I think Dr. Ansorg was prepared to take that question.
Yeah, I'm happy to respond to that. Supervisor Lavanini, through the chair, we are learning, obviously, as time goes by, about the behavior of the virus and also the behavior of the different variants. Initially, when we implemented the importance of the social distancing, it was mainly with the understanding that, the plumes of expiration, secretions with expiration were the main carriers of the virus, and therefore being close together would be the main way of getting infected. That is still true. So we do not recommend to, for instance, be in a crowded setting, let's say in a bar in front of a big TV watching the game, and without masks and or loud music, and people people are having fun, getting excited, yelling, and you have to talk into your neighbor's face or ear in order to get a word across. And that will definitely be a very, very high risk for this, droplet infection within 6 feet. Now, having said that, the virus actually is suspended in the air, much like cigarette smoke, in addition to this plume, in very, very, very fine particles that can remain in the air for a very long time. So the more people are in a room with poor ventilation for for a longer period of time, the more virus particles will be suspended in the air and remain there, depending on the level of ventilation, obviously. So we are looking at this airborne infection and at the droplet infection, which is both happening. So the social distancing is still important. However, when people are wearing a mask, really not that much. So I anticipate that in the very near future, we will come up with better recommendations. But as of right now, I think our infection rate is still relatively high. And therefore, the risk that you have people who are contagious in the room is quite significant. And that's why we still consider this.
Thank you, Dr. Ansorg. And I note, I really appreciate the new research on masks and the type of masks, and hope my colleagues up here will be wearing the high quality N95 masks going forward. I certainly plan to wear my masks to protect myself and the people I love, and I'm glad to have this information. I also wanted to say that we really appreciate your staff for working with early child care and daycare providers in our county. CDPH only allocated about 800 test kits for about 12,000 spots, childcare spots in our county. So public health really stepped up to supplement the Children's Resources Referral Organization with 12,000 testing kits. And they're distributing those to any accredited early childhood care sites in our county this weekend, along with free PPE. These sites are, we've learned through COVID, the backbone of our economy, and really necessary to keep childcare going so that parents can go to work. In addition, the majority of early childcare sites are small businesses owned and operated by women, and many are women of color. So keeping this critical workforce and the children they care for safe is really an issue of economic justice. So thank you so much, Dr. Del Reynoso, and your team assigned to help early child care on this and other guidance: Susan Klein-Rothschild, Georgine Lowe, Matthew Higgs, Jan Chatillo, and of course, Dr. Ansorg. With that, we'll go to public comment.
Chair Hartman and members of the board, we have 2 requests to speak on this item. And we will go to Zoom for Maria Kestner, to be followed by Dr. Amy Smith. Maria?
Hello again, Board of Supervisors. First of all, over 130 studies have shown natural immunity to vastly trump vaccine efficacy. Children have a 99.995% recovery rate, and the body of medical literature indicates that almost 0 healthy children under 5 years old have died of COVID. Number 3, a large study conducted in Germany shows 0 deaths for children under 5 and a case fatality rate of 3 out of 1 million in children without comorbidities. Number 4, Johns Hopkins study monitoring 48,000 children diagnosed with COVID showed a 0 mortality rate in children under 18 without comorbidities. Number 6, a study in Nature demonstrated that children under 18 with no comorbidities have virtually no risk of death. Number 7, Data from England and Wales, published by the UK Office of National Statistics on January 17, 2022, revealed that throughout 2020 and 2021, only one child under the age of 5 without comorbidities had died from COVID in the two countries whose total population is 60 million. Number 8, another study in Nature from April suggests children's bodies clear the virus more easily than adults. Number 9, this study published in December in Nature demonstrated how children efficiently mount effective, robust, and sustained immune response. The risks demonstrably outweigh the benefits of COVID vaccination in young children. A study out of Hong Kong showed 1 out of every 2,700 12 to 17-year-old boys being diagnosed with myocarditis following the second dose of Comirnaty vaccine, or 37 per 100,000 vaccinated. A study from Kaiser found the same rate of myocarditis in 12 to 17-year-old American boys, 1 in 2,700. While the CDC says that myocarditis is a mild disease, cardiologists know otherwise. CDC's own preliminary data reported at the February 4 ACIP meeting revealed that nearly half of the young people diagnosed with myocarditis still has symptoms 3 months later, and 39% had their activity restricted by their physician. We know this serious adverse event frequently occurs in teenagers, but no one knows how often it occurs in younger children. This is a major concern for babies and younger children. Again, wir haben es nicht gewusst, Herr Ansor. There is no consensus in the medical field. There is solely consensus in the bureaucratic government world, and dissent is now labeled as terrorism. And we've had enough of this. There is no science. And you are discriminating against the unvaccinated if you mandate a mask for unvaccinated people. Thank you very much.
Thank you.
And we will now go to Dr. Amy Smith, who is our final speaker.
Hello, can you hear me?
We can.
Good afternoon, Board of Supervisors. I'm very concerned by Dr. De Reynoso's claim that use of masks is what contributed to the drop in cases. There's, of course, problems with even the testing and the labeling of vaccinated versus unvaccinated, but there's also, other states that dropped mask mandates, and they had similar drops because this is following some factor other than the use of masks. And that is very poor science to pick one factor and assume that that is all the change that you're seeing in a graph when many other factors are taking place. And it's very disconcerting that that would be by a professional person brought forth as argument to continue a policy that is not shown to be effective, and also is now going to be implemented in a way that's very discriminatory. Who is going to be interrogating people as to their vaccination status, as to their willingness to get a gene therapy treatment that has no long-term testing for liability protected corporations that our health officials seem to work hand in glove with, and don't allow and protect and demand access to other treatments, that early treatment that have been very good at preventing hospitalization and death. And somehow that was withheld to us, which is why the US has a very poor rate of death compared to many other countries in the world. And, this record will be sorted out and people will be held to account. And it's very, very disconcerting and damage the trust in medical professionals and in health officials. And now it is time for our public elected officials to stand up and say the emergency is over. The right to take away these rights was never there in the first place. And the imposition of vaccine coercion on children, especially children, is totally unconscionable. But the Board of Supervisors can end the mandate at the next meeting, I suppose, for their own employees and set a good example. They can end the local mandate or emergency and set a good example that they are recognizing that there was never the authority to take away rights to stop a disease. With the vaccine, what they said in the early days with Alpha is that it dropped the hospitalization rate, but does not stop transmission. They never claimed that it did. But what they didn't tell you is it didn't reduce death overall. That more people died in the vaccine group. So that is very disturbing. And as health officials, it should be looking at the entire health picture. Like, what is the harm to children sitting in masks all day, not being able to see their teacher's face, not being able to communicate as properly, people with speech problems, people with a second language. This has been abuse and it needs to stop. And it needs to be across the board because vaccination does not stop transmission, as the CDC said. Thank you.
Thank you. Dr. Del Reynoso, Dr. Ansor, did you have any final comments for us today?
I would have one comment, Madam Chair. I just cannot accept these constant repetitions of absolute falsities. The COVID vaccine is by no means gene therapy. That is completely ludicrous. Gene therapy is used for very rare diseases where actually the individual DNA is manipulated in a way to eliminate a genetic disorder. Then again, to claim that more people in the vaccination group in the studies died, that is absolutely ludicrous and false. So I just really have a hard time listening to these repetitive falsities. And I just want to emphasize that we take concerns seriously, and there is not a lot of consensus in the medical field at all. I mean, there's a lot of consensus, and that's just what I have to say. Thank you.
Thank you. Dr. Del Reynoso?
Yes, it's disappointing to still hear the same misinformation. And I concur with what Dr. Ansorg has stated. I think moving forward, I think we need to focus on how do we exit this pandemic bubble in a safe manner. And our recommendation is a layered approach. We are really, as I showed you on slide 15, masking is part of that, but also vaccination and boosting. And I am encouraged that your board will consider wearing your mask, especially since you will be indoors and you will have you will be encountering individuals whose vaccination status is unknown. So thank you for the opportunity to provide updates and our thoughts.
And thank you for the good advice. I did have a constituent that had questions, and I'll send you that by email and respond to him in that way. It's a rather detailed question.
I actually prepared a response if you'd like to have it.
Okay, go ahead.
So the question is, between January 23rd, 2022 and February 5th, 2022, what were the COVID-19 infection and transmission rates in Santa Barbara County for unvaccinated person? The answer is the case rate on 123 for unvaccinated persons is 537.6 per 100,000. And for January 30th, it's 385.8 per 100,000. You could see that it's a decrease of 28%. And this information is available and can be found on our community dashboard at publichealthsbc.org under the summary tab. The second question is, between January 23rd, 2022 and February 5th, 2022, what were the COVID-19 infection and transmission rates in Santa Barbara County for persons vaccinated before August 1st, 2021, who has not received a booster shot? Unfortunately, this is we do not have this information. It is an interesting question, but we don't have this information, largely because we're not conducting we are conducting only limited case investigation and contact tracing in congregate settings.
Thank you so much for your responsiveness. Really appreciate it. So with that, I think we just need a motion to receive and file. A second?
So moved.
Second.
All in favor say aye.
Aye.
We are adjourned to Tuesday, March 1st, 2022, here in Santa Barbara.